Hello, welcome to the McKesson Idea Share Broadcast Center. I'm coming to you live from the trade show floor in this fishbowl in this beautiful facility. My name is Basil Maqbool. I'm Vice President of RxOwnership for the West. I'm joined today by a special guest, Katie Bass. We're going to be discussing 6 ways to generate revenue. Katie graduated from the University of Hawaii with her PharmD degree. She returned to Central California and now owns and operates 2 stores, Yosemite Drug and San Joaquin Drug. She's a member of many affiliated groups and advocacy groups, and in 2021, she was named IPC Pharmacy of the Year. Katie, thank you for joining me. I'm glad to have you.
Yeah, thank you so much for having me today.
I'm so glad you're here. We have a lot to discuss.
Yes.
I wanted to start off with how you got your start in ownership. I know it's kind of a unique story. It's a special story. If you can kind of talk about that.
Yeah. So I actually grew up kind of an independent pharmacy. My dad owns San Joaquin Drug, and he opened that in year 2000. And I was in high school at the time, and I immediately went to work for him. So I was the delivery driver, the janitor. Anybody that's grown up in an independent pharmacy kind of knows that pathway, right? You're all-around member of the family business. So then when I went to college, I went off and got my PharmD so I could come back and be a pharmacist. I graduated in 2014, and by 2015, I was PIC, and my dad was kind of out retiring. And then I officially took over ownership in 2019, and I also opened my second location that same year, Yosemite Drug. So yeah, it's kind of been a family thing. So second generation pharmacist, but yeah.
Did Dad give you a good deal?
Yeah, I mean, he comes back and works for me and babysits, so yeah.
Okay, that's good. Have you ever done a podcast before?
Once before. I did with Bruce Nealand. He's kind of a RX podcast legend, I would say, but it was a little bit different than this.
Yeah, you're a seasoned vet. We didn't know we'd be on camera. I didn't get my hair and makeup done. I don't have an entourage like I was expecting if you're going to be on TV, but that's great. So we want to talk about revenue. Revenue is the big topic this year at Idea Share.
Yeah.
We're talking about ways we can make more money, ways we can save money. You know, with the DIR fees and everything going on, reimbursements going down, it's important for us to pivot as owners.
Yeah.
And be, really, really ebbing and flowing with the market. You and I touched base before we sat down here, and you kind of explained some of the things you were doing differently. Mm-hmm. Some of the things you're doing, maybe some owners are taking advantage of it, but they're not using it to its full potential like you are.
Yeah.
Maybe there's things they haven't heard of. So I wanted to kind of walk through a couple of them, and we'll just kind of briefly touch on them, and you can tell me what you love about it, what you hate about it, why it was difficult, or maybe if it wasn't difficult at all.
Yeah.
Maybe it's easy for you to do, right? Does that sound good?
Yeah, that sounds great.
So point of care testing.
Yes.
We even have a booth here on the floor for a med surg team, and they sell the supplies. Pharmacists are now starting to incorporate this into their practice. Tell us a little bit about it.
Yeah, so we actually used McKesson Medical Surgical to, we initially started doing COVID testing. That's kind of how we got into point of care testing. I think if any pharmacy does do it, that's how they initially got into it. So Health Mart had rolled out a program where they were contracted with the government, and you could basically take a patient's sample and send it off to the labs. And they chose several pharmacies to work with, and we were lucky enough to be one of those pharmacies at my San Joaquin Drug location, because we're rurally located, underserved population. So we were really lucky to be out in that program. And then through that, that kind of gave us confidence. It was a new space for us. We'd never done point of care testing. Can imagine all the stress and pressure that came with COVID. But once we kind of felt comfortable with that, we then started doing the testing in-house as they developed the equipment for that. So then we were doing the COVID testing in-house, and it was actually generating really good revenue because we didn't have a pathway down for billing. We were just charging people cash to do it that way. So there was no dealing with insurances, and it was surprising how much people were willing to pay, because for a lot of people, it meant staying out of work and things like that. And so after COVID, we still kind of offer those testing because there's still some facilities that require COVID testing, or some people that just want to know those results right away or don't feel comfortable, especially some of our elderly patients. They don't feel comfortable doing the test themselves at home. So we have continued doing those services. And then we also expanded into strep throat and influenza as well. And then we did collaborative practice agreements so we can prescribe if patients do test positive. And it's been really helpful, like I said, in rural communities where they might not have access to urgent cares or same-day clinic visits.
So in terms of challenges to starting a program like this, are there special certifications you need? Is there special equipment? Can you train any staff member? Does it have to be a pharmacist?
So it kind of depends. I'm from California, so it's almost really state specific about what you
Okay.
have to do with your public health department. So I definitely recommend looking into that. You do have to get a CLIA waiver for your state, and then there is some Medicare licensing that's involved. It's pretty cheap, so it's not a super big upfront cost. And then you need a vendor or supplier. We use McKesson Medical Surgical because they were easy to access. There's also other ones out there to get the testing supplies. And then you need to make sure that you're OSHA compliant. So if you're doing certain types of swabs, you need the certain PPE and things like that. Through COVID, a lot of technicians were allowed to do testing because of the type of waiver that was in place. And certain states have extended that. California extended it. And other states have limited that. So you really have to kind of check on your state-specific thing. But yeah, if you're in our state, or if our techs are trained, we can allow them to do the testing portion of it. So I allow our techs to do the portions. The pharmacist still has to interpret the results and everything like that. And there are definitely some challenges. Like I said, I don't know if we would have started the program without the COVID pandemic and kind of getting introduced to it that way. So that kind of gave us a lot of leeway because everybody was really pushing pharmacies in the testing pathway. There was so much information out there making it easier to start that up in your pharmacy.
So that's a good point. You saw an opportunity, you took an opportunity, which nobody really knew what was going on in COVID. A lot of pharmacists stepped up and they really kind of learned as they went.
Yeah.
And now now that the pandemic's over, you've parlayed that into a further, like just a continuous revenue generation, right?
Yeah.
That's great. That's great. Point of care testing is very clinical. Clinical services. We talk a lot about that. In the past, the only thing people ever heard of was MTM, right?
Mm-hmm.
It was great. You logged into a computer, you did a couple cases, you asked a couple questions. That was the extent of it. You've taken it a couple steps further. Talk about what you're doing.
So in California, pharmacists do have some prescribing ability. So 3 categories that we really utilize in the pharmacy is birth control prescribing, naloxone prescribing, which now isn't as big as you can get Narcan over the counter, and smoking cessation. So smoking cessation has actually been huge for us. We kind of worked with a group and we initially got a grant to start some smoking cessation. I had always been able to prescribe it, but we couldn't quite figure out how to go about it. And then we started right at the point of sale asking patients if they smoked or used tobacco. If the patient answered yes, we asked them if they wanted to quit, and then the pharmacist would intervene right there. On the spot, I would come consult them. I'd prescribe them the patches and the gum right there. We'd bill their insurance because it was covered by most insurances, and Medi-Cal especially. And so then we could get the patient those services right away. And Medi-Cal pays decently, luckily, in our state, which is our Medicaid program, excuse me. So yeah, we were able to generate revenue right there, right at the counter, and help these patients who wanted to quit. I mean, we all know how advantageous it is to quit smoking. So it was really a dual benefit. And then some of those patients weren't even our patients and ended up transferring over because they heard a friend that used our program and they realized how we were really a different pharmacy setting than your traditional pharmacy. So that's one of the ways we've really tapped into really that niche area of smoking cessation.
Okay. The oral contraception. Can you talk a little bit about that?
Yeah, so pharmacists are allowed to prescribe oral contraception as well in our state. So I've been doing that for a while now, and I charge cash for that. So for the consulting fee, I charge about $15 to $20. And then most the insurances now will pay for birth control prescribed by the pharmacist, so it'll go through their insurance fine. But I just make them pay cash for the consulting visit. And it's a pretty quick process. California has a certification program. You just have to do an hour of CE each year, but they really provide all the documentation. I pretty much have to take a blood pressure, ask the patient a few questions, and then I can prescribe it. For women who are working or who've had a hard time getting into the doctor, or I've had women too who, feel like they can't really have a discussion with their doctor about it for whatever reason. And especially with, all the women's issues, and birth control is really a big hot issue right now. So it's really been a positive thing for a lot of our patients to know that they can come into the pharmacy and get that service.
I mean, you bring up a couple really good points, right? One is you can charge for those consult fees. Normally patients have to take time out of their day, take time off work, go to the doctor's office. They're paying a copay anyway at the doctor's office. They can come to you, skip all that.
Yep.
Get their medication, they can, move along. You've got more accessible hours, and you can kind of come in on your schedule. And I think for pharmacists specifically, this is a lot of times information that we've been giving away for free traditionally, right?
Yeah.
Patient comes in, doc, I need to quit smoking. What should I do? And you'll recommend 1, 2, 3 things, and you say, go talk to your doctor. But now you have the ability to write that prescription after consult, which I think is fantastic.
Yeah, it really is amazing. I'll say, like, as the training gets more and more in depth for pharmacists, I think not only should we go into clinical skills because it can be revenue generating, but I also think it proves the knowledge we have. I mean, we've often been thought behind, most people don't even realize we're doctors. They just think we count pills by 5. And we have such a wealth of knowledge. And I think using it in that clinical practice really builds trust with your patients. Now I have a lot of patients, even some of my employees, like, I had no idea pharmacists knew this amount of information. I trust you now more than my doctor or my nurse. So I think just integrating clinical services can help build those patient relationships and that trust in the profession.
When they say that, you should get them to sign off on it so you can show their doc,
I know, right?
Like, hey, doc, look at this. That's awesome. Thank you so much for
Yeah.
that. So, immunizations. I know you're running some clinics.
Mm-hmm.
I graduated many years before you in 2001, and at that time they didn't even train us to do shots.
Yeah.
We had to go to a CE, and the only shots pharmacists did were flu shots. Over the years, we've seen these programs expand.
Mm-hmm.
Tell us a little about what you're doing and how you're doing it and how it's benefited your store.
So much like you, my dad didn't get trained to do any of the immunizations or anything like that. It wasn't until I graduated school and came with that new grad energy and was like, we're starting this immunization program, and all gun-ho about it. So forced him to go through the APHA certification process. And then same thing, we just brought over flu vaccines initially. And then we realized that it could really be a great revenue generator for us. And so then we brought over pneumonia and shingles and those types of vaccines. And I mean, I'll say we have tried some vaccines and the uptake just hasn't been as good. For whatever reason, we have a harder time getting patients on board with it. So not every single vaccine is going to work out. One of the really unique things we have done or do is we partner with an adult daycare facility, and we will go to their site. They'll give us their patient's information ahead of time, the Medicare, Medi-Cal, so we can bill it, make sure it's going to be covered and paid for. And then I'll go on site and I'll do COVID and flu vaccines for the season for them. And I get to do, 30 to 50 patients in like an hour or two period. So it's kind of an amazing, easy way to generate a bunch of revenue and help their patients in the facility out. And then another thing we've done is partnered with the schools, our local school. So this is really unique. In California, students can't start their 7th grade until they've received their Tdap vaccine. Well, we only have one local clinic, and a lot of times they run out of the vaccine. And so the kids aren't allowed, or they have to make an appointment that's weeks out from when school starts. So the school asked us, hey, would you be willing to do these vaccines? And because of this certain program, we have a vaccine for children's program in California. So a lot of the Medicaid plans won't actually pay pharmacies to give vaccines to kids without a prior authorization. So I explained that to the school, and they said, we'll just pay you out of pocket. You do the vaccines for the patients, tell us what we owe you. So I was able to charge them the dispensing fee, and all the vaccines that I ordered were used, and they paid for all of them, just straight cash. It helped them out. They don't get paid unless their students are showing up and going to school. And it's a great community service. The parents show up, the kids aren't vaccinated. They say, go next door to the pharmacy, go get vaccinated and come back. So the kids can start back in school that day. So it's really about building and utilizing those relationships and seeing how you can help your community out.
New marketing tagline, keeping kids literate. Now you can kind of start selling that too. Because without you, they can't get educated.
Exactly.
That's amazing. And I think something to touch upon that you mentioned was you're going to some of these facilities to give these shots. I hear that now with Medicare this year, for some facilities, they're going to start reimbursing for your travel on site. Is that right?
Yeah, so I've heard that too. We did have, we kind of started dabbling in that in this past fall, and we did a couple home visits and then, worked to build Medicare. And we actually did get paid more for going to the home. So it is kind of filling out that billing situation. I haven't done it for these big clinics, I'll be honest, but we did for a couple of our patients that, they can't leave home for whatever reason. I have gone off-site. I'll go before work or after work and go give them their vaccines or build a day in where I'm off and just go to their homes. And so we're able to bill for a few of those as well.
That's amazing.
Yeah.
So now we're kind of moving away from the clinical side, right?
Okay.
We've kind of discussed all these clinical initiatives and things you've done. Let's talk about how you get involved in the community and how that's led to revenue generation. You mentioned public health partnerships to me.
Mm-hmm.
We talked about that a little bit. Let's tell the audience what that's about.
So, like I said, we're kind of from a small rural area, so we've had a lot of opportunities to work with our public health department on several different fronts. and our local health plans, our Medicaid programs. So now they're kind of coming to us to offer extra services for them. We partner with the public health department with an annual health fair every single year. Our pharmacy, San Joaquin Drug, my mom started a health fair, and we've continued it and offered free vaccines to patients that are uninsured in a partnership with public health department. And now it's great they're reaching out to us. Most recently, they reached out to us about possibly doing a delivery system for some of their homeless patients that are having a hard time getting medication. So, I mean, just through word of mouth and working with the public health department in the past has given us these different avenues.
I think it shows your flexibility, right? When you show an entity that you're flexible and you're willing to grow and learn with them, opportunity can come to you.
Yeah.
And you never know where that opportunity is going to lead. You know, it can end up becoming a huge revenue driver. You don't know.
Yeah, exactly. And I will say, you know, I'm very community driven. And if you didn't get that, empathetic and passionate. And you'd be surprised. I always felt like awkward talking about money, you know, and asking for that. And you'd be surprised how many people are willing to pay for those services, how much they'll cover extra. We have, in fact, at my other location, we serve the county jail system. We do their bubble packing for them. And they wanted me to increase my insurance policy. And I said, I don't know if I can do that without you covering it. They said, okay, we'll pay for it. So, I mean, you never know what grants or money is out there in these public health departments and these, you know, because that's through the Mariposa or the county health department, I should say. So, I mean, it's amazing. There are funds out there to utilize. And so I think you should be willing to ask for them.
Yeah, what's the worst they can say is no.
No,
right?
exactly.
Nothing changes. They said no, you move on to the next thing.
Yeah.
Right? So that's actually a really, really good point. So you mentioned grants.
Yes.
I know you're doing a lot of different grants, and some of those grants are affiliated with studies as well.
Yep.
Let's touch on that.
So one of the ones we're just kind of getting started with is actually going to be HIV preventative injectable drug. So there's a couple of us in California working on that with the UCF study. And it's just starting out, but they got a pretty large grant. And so they're able to give us a big chunk of money for doing the training. And then they'll follow patients as we learn how to inject HIV preventative medications, you know. So not only are we helping our patient population and able to offer this service, which is pretty amazing. I mean, we're in a rural area, so I will tell you, we have one provider that even provides these services for our county, and he's not actually in our county, he's county adjacent. So
and he goes on vacation.
Exactly,
right?
Exactly. So just trying to figure out those hurdles. But I think if you put yourself, like you said earlier, being flexible, if you put yourself out there, you know, that's how we got started on the smoking cessation program. Those were all different grants. The same thing with community health workers, which if you see me around the show, I've been talking a lot about that.
Yes.
But there's
that was actually going to be my last point. But
I
you
jumped
right
ahead
to.
of you. I'm so sorry.
Listen, I'm the interviewer. You got to let me tee you up a little bit. Come on.
Okay, I'm sorry, cutting you off. But yeah, that's another area where there's a lot of money available. So again, it's just searching for those things. Public health is a great resource. Your local Medicaid programs, Medicare programs. There is a lot of funds out there using your public health department. All those different partnerships can lead to a lot of revenue generation.
So you jumped ahead. I wanted to ask on the studies specifically. I know there are some online resources. Let's say an owner goes online. What would he look for to try to find, or what would he or she look for to find a study in their area?
So it depends. Like I said, luckily I've had enough relationships and partnerships now that I'm kind of being approached, which is really nice. I really started out by joining a lot of organizations and networking. So I'm a member of my state association. I'm a member of CPESN and NCPA. APHA, there's a lot of pharmacy organizations that will give you introductions to people who are doing these things. I mean, being involved in CPHA allowed me to meet people who were involved in academia. And they're the ones a lot of times getting the grants, getting the funding to do these types of studies. So partnering with them, they're like, hey, I want to do this study, but I need a practice site. And then there's also other pharmacies I know that come up with their own studies and find funds. You can also find grant writers. This is kind of a cheat, but my sister's a grant writer.
Oh, wow.
And so sometimes I'll pick her brain, or she'll send me things like, hey, did you know this is available? This is available. So yeah, I learn a lot that. And like I said, I've also used our state Medicaid program a ton and the Department of Public Health as well for grants and funding.
So we'll have to get your sister a booth here next year.
I know. She can do some grant writing for everyone. Grants. Yeah, exactly.
So, taking all that into account, I heard you say state associations. A big key touching point for McKesson this year is advocacy. So I think it's a good, to your point, joining these state associations, being involved, being active to get pharmacists the ability to do these types of testing, do these types of procedures, and to bill for them is very important, right? So we need to get more and more pharmacists involved in using their voice. It's not always just about money.
Yeah.
Sometimes it's just about your voice. I think pharmacists tend to get into a rhythm. Like you find that pharmacist is used to going left to right.
Yep.
And that's all he wants to do. And then it carves out a space for people like yourself to kind of go between the lines and make some real money.
Yeah. Yeah. I think advocacy is hugely important. I think it's important to come up with these other ways to generate revenue. I think it's the direction that pharmacy is going. I think as our training has gotten more difficult and we obviously have the knowledge base we do, I definitely think we should go beyond dispensing. I mean, I think that's just a natural flow. But I will say for a lot of our pharmacies, especially in the rural one, dispensing's still our bread and butter. I mean, we have to dispense to our patients. That's how we help take care of our patients, right? Getting them their medications. Mail order might not be an option, or there isn't a big box retailer that they can go to. So I think advocacy is important for both those fronts. And I mean, who's to say if we don't push back on the PBMs, who's to say they're not going to come interfere with our clinical services, if they get involved in that billing process. So I think it's really important for both sides to keep, traditional pharmacies alive and to help us push forward in the clinical side. I think we're going to need advocacy. I think we need the state associations, the national associations, and we're finally seeing that. I think for a long time, pharmacy has been too split, and I think fortunately, we've been driven together. It's great to see all these different networks coming together, united under this one cause of our profession. It's really great to see, and I'm very passionate about it. So if you're not involved in your state advocacy group or NCPA, get involved now. We need all the voices and help we can get, for sure.
And if people aren't involved and they have questions, see us on the trade floor, come up to us, talk to us. We're happy to have that conversation, right?
Yeah.
So you've given us a lot of excellent information, a very brief amount. We just kind of have to touch on it briefly because we don't have all day.
Yeah.
What's the one key takeaway you want to leave with everyone listening today, or watching for that matter?
I guess just be creative. And like I said, be flexible. I think you put it out there really well. I think that's what's so unique about independent pharmacy is we don't have to go up the corporate chain. I mean, we are the last stop, right? So be flexible, see what's out there, and don't be afraid to ask for that money, for that help to do those things. It's amazing what's out there. I mean, if you're going to offer it for free, which we've always done as pharmacists, they're going to take it for free. So I think we need to start pushing back and make people aware that our services are valuable. And I think people are seeing that a lot more. So yeah, be flexible and don't be afraid to ask.
It's about shifting the paradigm. And I think owners like yourself are starting to do that.
Yeah.
And I think the tides are turning. It's finally starting to come to a place where it's going to become the norm.
Yeah. I hope to see that, yes.
Me too.
Very much.
Katie, thank you so much.
Yeah.
I think everything you've taught us today has been very, very valuable. I appreciate you taking the time out of your schedule. And from all of us at RxOwnership, thank you for watching. Thank you for listening. And we'll catch you in the next one. Have a great night.